What happens if you wake up in the morning and suddenly you can't feel your legs? Yes, the same thing is happening in people of Maharashtra, specifically in the Pune region, and it has even succeeded to take a life. This is GBS, that is Guillain-Barre syndrome. People usually acquire Guillain-Barre syndrome because of drinking contaminated water or eating contaminated food. This contamination may be because of many reasons. The most common among them is Campylobacter jejuni, which is a bacteria, and sometimes we can even find the cytomegalovirus. When the organisms enter our body, our immunity tries to tackle against those organisms, so it produces antibodies. These antibodies, while attacking these organisms, also attack the nerves of our body, which causes paralysis. If we dig into the progression of the disease, it all starts with drinking either contaminated water or eating the contaminated food. After a few weeks, when the person wakes up in the morning, he starts to have rubberiness feeling in the limbs, which is often ignored. As the day progresses, he starts to have a numbness and tingling sensation in the limbs, and within no time, it can turn to weakness and even paralysis of the same limbs. As we say, prevention is better than cure. So it's better to avoid the outside food and tap water, and always wash your fruits and vegetables, and it is better to boil the vegetables before eating. Now, how to treat the disease? As soon as the patient arrives, clinical diagnosis is enough to start the treatment. We should not wait for other investigations such as CSF, neuroconduction studies, or electromyography, which can be done parallelly along the treatment. So we have to start the treatment first. In the treatment, we will use the intravenous immunoglobulins, that is IVIG, or we can even go for plasmapheresis. Now, if the treatment is delayed, the paralysis ascends from the lower limb towards the upper limb, and it can go till the chest region where the respiratory muscles get paralyzed and the person can end up in respiratory arrest.